Emotional regulation refers to the processes individuals use to manage and respond to their emotional experiences in appropriate and adaptive ways. This can involve strategies to amplify, maintain, or decrease one's emotional responses, such as rethinking a challenging situation to reduce anger or anxiety, or focusing on positive aspects to foster happiness. The ability to regulate emotions is crucial for mental health and well-being, as it affects how we cope with stress, interact with others, and make decisions. Effective emotional regulation can lead to improved relationships, better academic and work performance, and overall life satisfaction. Personality traits significantly influence how individuals experience and regulate their emotions. For instance, people high in neuroticism may struggle more with emotional regulation, often experiencing intense negative emotions and finding it challenging to employ effective coping strategies. Conversely, individuals with high levels of conscientiousness or emotional stability tend to use more adaptive emotional regulation strategies, such as reappraisal, which involves changing the way one thinks about a situation to alter its emotional impact. Certain personality disorders can severely impair emotional regulation, making it difficult for individuals to manage their emotions effectively. Borderline personality disorder, or BPD, is a condition where individuals often experience intense emotions and have difficulty maintaining emotional stability. For example, they may engage in frantic efforts to avoid real or imagined abandonment, which can manifest as extreme behaviors such as impulsive spending, substance abuse, or tumultuous relationships. If they perceive a partner pulling away, they might react with intense anger or desperation. This can lead to behaviors intended to cling to or control the other person, ultimately exacerbating their fears of rejection and further destabilizing their relationships. Antisocial Personality Disorder, or ASPD, is characterized by a lack of empathy and emotional responses, which can impair the ability to regulate emotions like guilt or remorse. For instance, an individual with ASPD may engage in harmful behaviors without feeling any emotional consequence. This can lead to a cycle of destructive actions that further alienate them from others and worsen their interpersonal relationships. Avoidant Personality Disorder is a condition where individuals often experience heightened anxiety in social situations, resulting in avoidance behaviors. For example, a person with avoidant personality disorder may excessively ruminate over past social interactions, leading to intense feelings of shame and inadequacy. Their fear of negative evaluation can cause them to withdraw from social opportunities, further exacerbating loneliness and emotional distress. Narcissistic Personality Disorder. Those with this disorder often have an inflated sense of self-importance, which can lead to difficulties in regulating emotions such as envy, anger, and disappointment. For example, if a person with narcissistic personality disorder receives criticism, they may respond with rage or contempt, struggling to process these emotions in a healthy way. This can create conflicts in relationships and reinforce their fragile self-esteem. To distinguish a personality disorder from a mere personality trait, certain criteria are considered. Personality disorders are pervasive and enduring patterns of behavior and inner experiences that deviate from cultural expectations. They typically manifest in adolescence or early adulthood and persist over time. Personality disorders often lead to significant distress or impairment in social, occupational, or other important areas of functioning. In contrast, personality traits may not cause such disruptions in daily life. Individuals with personality disorders exhibit inflexible and maladaptive behavior patterns that are resistant to change, while personality traits can be more adaptable. The benefits of effective emotional regulation are manifold. Improved mental health. Individuals who can regulate their emotions effectively are less likely to experience anxiety and depression. A study published in 2019 titled Emotion Regulation and Mental Health, a meta-analytic review in the journal Clinical Psychology Review, emphasized that adaptive emotion regulation strategies are linked to better mental health outcomes. Good emotional regulation can lead to healthier interpersonal relationships. For instance, a 2021 study titled Personality Traits and Interpersonal Emotion Regulation, published in the journal Personality and Individual Differences, explored how personality traits influence interpersonal emotion regulation, finding that individuals who are more empathetic and agreeable tend to help others manage their emotions better, fostering stronger social bonds. Emotion regulation allows individuals to make more rational decisions rather than impulsive ones driven by intense emotions. This is particularly important in high-stress situations where clear thinking is essential. Emotion regulation contributes to resilience, enabling individuals to bounce back from setbacks without being overwhelmed by negative emotions. A common and effective strategy for emotional regulation is reappraisal, which involves changing one's interpretation of a situation to alter its emotional impact. Research published in 2014 titled The Neural Basis of Emotion Regulation: Insights from Neuroimaging Studies. In the journal, cerebral cortex has shown that this strategy is associated with increased activity in cognitive control brain regions and decreased activity in areas linked to emotional responses, such as the amygdala. A study from 2020 titled The Role of Early Childhood Education in Emotional Regulation Development, published in the Journal of Child Psychology and Psychiatry, focused on the development of emotional regulation skills in children, emphasizing the role of early childhood education in fostering these skills. It found that children who learn to regulate their emotions early on tend to have better social and academic outcomes later in life. Personality plays a crucial role in how we experience and regulate our emotions. Understanding emotional regulation, its benefits, and the impact of personality disorders can help individuals navigate their emotional landscapes more effectively, leading to improved mental health and better interpersonal relationships.